We will be recording this meeting for purposes of sharing with members of the public who cannot attend. Please remember that this is a public meeting and we are live on YouTube, and the chat is subject to public record. If you have connectivity issues, please contact Liz Lorkey. Next slide, please. All right. Again, my name is Jessica Carroll. I am the fee-for-service operations and quality assurance manager in the policy unit of the Medicaid division at OHA. On the next slide, we're going to review the agenda. All right. So first, we're going to go over some quick housekeeping, and then we're going to do a waiver overview, give some background on the waiver, go over the extension request and its intentions and goals. Then we're going to talk about the extension request details and the timeline. Then we will open for public comment, and once that is over, we'll go ahead and close the hearing. Next slide, please. All right. For our housekeeping, our presentation will not be paused while it is in session. This public hearing is being live streamed via YouTube and recorded. The recording will be available on OHA's YouTube page and posted to our SUD 1115 waiver website as soon as possible. Everyone's voice matters. Please keep comments focused to allow others the space to be heard. Questions will not be answered today. You can send your questions to sud.waiver@odhsoha.oregon.gov. Opportunities for discussion will be announced publicly as they become available. A sign-up sheet will be passed around for in-person attendees wishing to make a comment. If there is remaining time, we will be available for additional comments. OHA staff will remain present until the scheduled hearing time is complete. Next slide, please. All right, so for virtual attendees, you may raise your hand at any time during the presentation to queue for comment. Comments will alternate between virtual and in-person participants. Please wait to be called on by name. Each comment will be limited to 3 minutes. Please state your name and organization. Virtual attendees should type their name, organization, and email in the chat if commenting. This can be done at any time. If making a comment virtually, when completed, please lower your hand. All public comments will be summarized and shared after the public comment period closes. Next slide, please. All right. Now we're going to talk about the history of Oregon's 1115 SUD waiver. The SUD 1115 demonstration waiver is a special approval from the federal government that allows states to test new approaches in delivering Medicaid-funded substance use disorder services, or SUD services. Under Section 1115 of the Social Security Act, states can apply for waivers to implement innovative treatment strategies, expand access to care, and improve outcomes for individuals with SUDs or substance use disorders. Pardon me. These waivers give states flexibility to implement programs that may not fit traditional Medicaid rules. such as covering new types of services or making changes to eligibility requirements to improve care and reduce costs. Next slide, please. All right. So first, let's explore a little background together. OHA committed to transforming its substance use disorder or SUD treatment system to improve access, equity, and outcomes for Medicaid beneficiaries. To achieve this, OHA sought federal partnership through an 1115 demonstration waiver, focusing on strengthening the state's continuum of care for SUD treatment. Approved by the Centers of Medicare and Medicaid Services, or CMS, in April 2021, the waiver set Oregon on a path to implement evidence-based practices, enhance provider capacity, and integrate culturally responsive and co-occurring disorder services across the state's behavioral health landscape. This waiver expanded service delivery options so beneficiaries with a wider range of needs would have access to the appropriate level of care. This foundational work, undertaken during the initial waiver period, April 8th, 2021 through March 31st, 2026, has laid the groundwork for lasting systemic improvements while highlighting ongoing challenges and opportunities to further expand and refine our system. Next slide, please. The state of Oregon is requesting a 5-year extension for its substance use disorder treatment delivery system. Through this extension, Oregon's efforts will lead to better health outcomes for those individuals with substance use issues. Oregon will explore aligning the SUD waiver period with the Oregon Health Plan, or OHP 1115 waiver period. Oregon anticipates this change will not only reduce the administrative burden on reporting requirements of 2 separate waivers, but also create better opportunities for alignment of waiver goals and measurements under Oregon's Medicaid quality strategy. The additional period will support Oregon's efforts to continue developing the SUD continuum of care throughout the state and demonstrate the impact of care for individuals at all stages of recovery. This extension will further enable Oregon to effectively implement the necessary changes to the Oregon Medicaid Management Information System, or MMIS, provider portal to offer the $5,000 lifetime benefit to individuals as they transition from a residential setting to their own home through the Community Transition Services Offering, or CTS. Oregon is also requesting a new expenditure and waiver authorities to provide contingency management to individuals diagnosed with a substance use disorder. Contingency management is designed to motivate individuals in recovery by offering incentives for meeting treatment goals. Contingency management is an especially beneficial treatment option for stimulant use disorders. Unlike opioids, there are no FDA-approved medications to treat the use of methamphetamines, cocaine, and other stimulants. Evidence shows contingency management to be the most effective evidence-based therapy to improve treatment outcomes, including the decrease or termination of drug use and longer participation in treatment among those with stimulant use disorder. The goal of adding contingency management to support Oregon's treatment programs directly supports the improvement of the continuum of care by providing a structured, evidence-based approach to reinforcing recovery behaviors. We have an FAQ sheet available here today in person, and we will drop a copy into the chat for those who are attending virtually on contingency management. Next slide, please. So just to reinforce, this additional 5-year period aims to support the growth of a full continuum of care, enhancing access to quality treatment, increasing treatment engagement, reducing repeat visits to emergency departments and inpatient care, and improving outcomes for individuals with substance use disorder. Help Oregon implement needed updates to the Medicaid Management Information System, or MMIS, provider portal, allowing individuals to access a $5,000 lifetime benefit when transitioning from residential care to independent living through Community Transition Services, CTS, and implement new expenditure and waiver authorities to provide contingency management, improving outcomes and fostering more sustainable care. Next slide, please. The state of Oregon worked setting 4 waiver goals, outlining what our demonstration is setting to achieve. These are going to be the same moving forward, with implementation of contingency management to support each one overall. Oregon's first goal is increasing identification, initiation, and engagement pardon me, of Medicaid beneficiaries diagnosed with substance use disorder. Second goal is to assist the state in increasing beneficiary adherence to and retention in substance use disorder treatment programs. The third goal is to assist Oregon in reducing inappropriate or preventable utilization of emergency departments and inpatient hospital settings through improved access to a continuum of care. And the fourth goal is to provide a continuum of care to increase the chances of Medicaid beneficiaries having a successful recovery process. All right, can I get the next slide, please? Central to the approved waiver is the focus on enhancing residential and inpatient treatment services as a crucial component in the continuum of substance use addiction benefits. It accomplishes this by permitting Oregon to receive federal funding for Medicaid services for individuals with a substance use disorder in residential treatment facilities with more than 16 beds or institutions for mental disease, IMDs. The other major component of this waiver increases the service array for Oregon Health Plan members with substance use disorder to include community integration services composed of housing and employment support. Oregon is implementing this benefit to help people transition from institutional and residential settings to their own homes within their communities. The added flexibility from the waiver to provide these services has furthered Oregon's goal to prevent, identify, and treat people with substance use disorder and help them sustain long-term recovery. Next slide, please. All right. The state of Oregon is expanding its treatment options by adding contingency management to its existing demonstration programs. Contingency management is designed to motivate individuals in recovery by offering incentives for meeting treatment goals. This benefit will be available through Medicaid participating providers who opt in and receive state-approved training. Contingency management will be offered alongside other therapeutic interventions, such as cognitive behavioral therapy, and will be modeled after successful programs in other states and Oregon's own state opioid response, or SOAR, initiatives. Contingency management is one of the most effective behavioral interventions for the treatment of substance use disorders. Contingency management is an especially beneficial treatment option for stimulant use disorders. Evidence shows contingency management to be the most effective evidence-based therapy to improve treatment outcomes, including the decrease or cessation of drug use and longer participation in treatment among those with stimulant use disorder. Next slide, please. So, key initiatives including codifying flexibilities and Oregon administrative rules, adopting a consistent ASAM framework, and improving provider licensing and certification and staffing have laid the groundwork for sustainable progress. The assessment, conducted by Oregon Health Sciences University and Portland State University in October 2022, further highlighted areas for improvement, leading to increased provider reimbursement rates and the establishment of ASAM 3.7 residential care. Additionally, Oregon has extended its efforts beyond integration services, creating pathways for crisis intervention and early recovery support. These expanded services have not only strengthened the state's continuum of care, they have also successfully reduced emergency department utilization statewide. As a result, Oregon continues to lead by example in addressing substance use disorder, providing a comprehensive and accessible system of care that prioritizes recovery and community reintegration. So again, just to revisit these key points we've gone over. We've updated rules for SUD treatment. Oregon has made key updates to rules for both residential and outpatient addiction treatment, enhanced support programs, new reimbursement programs support outpatient services and licensed professionals providing co-occurring disorder care and culturally specific services. Rate increases in workforce support. Behavioral health providers received a 30% rate increase funded by Medicaid savings. Additional funding in December 2023 helps address workforce shortages by supporting hiring and training efforts. Expanded Medicaid services. New billing codes have been added to expand service available to Medicaid beneficiaries, and updated education and prescribing guidelines. OHA has updated opioid prescription guidelines to follow the latest CDC recommendations, focusing on patient-centered care. The Prescription Drug Monitoring Program helps providers follow safe prescribing practices and stay in line with federal and state rules. Next slide, please. All right, so looking at our timeline from the beginning and moving forward, we made our initial waiver application in 2020, and it was approved in 2021. We are currently in our public comment period, which will end on March 20th, and we expect to make our extension request to our federal partners by March 31st. The process of review takes about a year, and if we are approved, we can look towards better aligning with our OHP 1115 waiver and begin our new period of waiver services in 2027. Next slide, please. On the next few slides, we have an overview of the different ways public comment can be submitted over the course of our open public comment period through March 20th, 2025. As you can see, comment can be given in written formats, both via mail and via email at the addresses on your screen. Now we will begin the public comment submission period. Do we have anybody waiting in the lobby? All right, not seeing any hands. I'm going to go ahead and mute myself. I will check back with those of you watching on YouTube. Again, you're welcome to enter the Zoom room and make public comment. All right, we are now going to close the public comment period. Next slide, please. All public notices, draft requests for extension documents, and other related details are available on our website, and we've put a link on the slide. We can also drop that in the chat. Next slide, please. All right, thank you. We appreciate the time you've allowed us to spend with you today. Please reach out to us at any time with questions or concerns. Thank you. And if you'd like to submit your questions or your public comments in email, please send them to sud.waiver@odhsoha.oregon.gov. Thank you and have a great Thursday.